The most common place to see a positive FAST exam in a pediatric patient is the pelvic exam. This is interesting. This was a 2017 retrospective analysis, and they looked at where do kids show free fluid first. And what they found was actually really interesting. And I did not know this until I started digging into this a couple years ago. They had 103 kids who had an exam, and they found that 95.1%, so 98 out of the 103, had fluid present in the pelvis. It said overall the most frequent location of fluid outside the pelvis was found at the inferior tip of the liver. That's that caudal tip we were talking about. So it makes sense that we understand how to do that pelvic exam, and especially if we know that this is going to be the most common place that it presents with kids. I was speculating maybe it's because people pick up kids and they hold them and it kind of drains down into the pelvic region. But let's talk about how to do this exam. So we have the pelvic marker facing up towards the patient's head. This is going to give us a nice sagittal view. And so when you're looking at the actual image, you may see the sigmoid colon. You may see it kind of moving around. You'll see the bladder, and we're looking at the rectovesical pouch. This is right behind the bladder. It's between the bladder and the rectum. In females, you have the uterus here. It's between the uterus and the rectum, but it's always between whatever is right above the rectum. And so here we can see a nice full bladder acting as an acoustic window for us. We do see that that colon right here, sigmoid colon, and we don't see any free fluid. This is where you would see the free fluid would be right here. We would see black anechoic stripings or tracings in this area. Now, let's take a look at this. We'll fill this up with blood, fluid, and now we can see exactly what that would look like on ultrasound. So we have the bladder, and you're looking at the bottom left corner of the bladder to see if you have free fluid developing in there. Just a quick caveat, like I said, there's going to be a uterus in females between the bladder and the rectum, and that is called the pouch of Douglas, and that's where it would develop in females.